Atrial fibrillation is a specific rhythm of the heart characterized by the top chamber or the atria beating very irregularly and chaotically. The normal rhythm of the heart relies on the top chamber of the heart beating in a coordinated way, and this usually pumps blood into the main pump of the heart. When the top chamber of the heart becomes very irregular, not only does it lose its contractility, but also results in the heart beating quite fast and irregularly. And this is what atrial fibrillation is. In some patients, it can be associated with serious consequences, and there are two areas in particular which need to be addressed. One is the risk of strokes, and because the top chamber of the heart doesn't beat properly, it can encourage blood clots to form in that chamber. And these blood clots can then embolize or move to other areas of the body and can cause problems to other organs, in particular the brain, where there is an elevated stroke risk in some patients. The second is that because the heart usually beats quite fast and irregularly, if left untreated, can result in the muscle of the heart getting quite weak, and this can also cause what we call ventricular dysfunction or heart failure in the future. Symptoms of atrial fibrillation are again quite varied and depend on the type of atrial fibrillation the individual has. The first type is termed paroxysmal atrial fibrillation, and what that means is the patients are not in the rhythm disturbance all the time, but it comes and goes. And these patients typically describe a sudden change in their heartbeat from beating normally to beating very fast and irregularly. And this causes symptoms of palpitations, which is an instant awareness of the heart beating fast and irregularly. The second type of atrial fibrillation is where the rhythm is irregular all the time. And although these patients do describe their heart beating irregularly or palpitations, these patients also describe other symptoms of increased breathlessness, reduced exercise tolerance, and also lethargy and fatigue. In some patients, it can also cause dizziness and chest pains. So the symptoms are quite varied for atrial fibrillation. I would say the predominant symptom is that of palpitations, so feeling of the heart beating irregularly and fast. Treatment of atrial fibrillation is broadly described in two categories. One is to try and reduce the individual risk of stroke, and this is based on a risk stratification scheme that we have, and this will determine whether the patient requires anticoagulation to reduce the risk of stroke. The second is trying to treat the rhythm itself, and in most individuals, particularly if they are symptomatic with the atrial fibrillation, will be aimed at trying to keep the heart in a normal rhythm for as much as possible. This could involve drugs, and there are specific drugs for atrial fibrillation to keep the rhythm normal as much as possible. In some patients, it requires an electrical resetting procedure to reset the heart from atrial fibrillation to a normal rhythm, and this is called a cardioversion. And in specific patients where the atrial fibrillation is causing quite significant symptoms and affecting the individual's quality of life, there are procedures to try and treat the atrial fibrillation itself, which are mini surgical procedures called ablations. And this again can help patients stay in a normal rhythm as much as possible, and thereby increasing the patient's quality of life and reducing symptoms related to atrial fibrillation. I'd probably say it is less of a common trigger for atrial fibrillation. Atrial fibrillation, for example, can be associated or caused by sleep in some people. At the other extreme, it can be associated with high adrenergic events such as exercise, but it tends to be multifactorial. And although I think it's normal for patients to try and find triggers for the atrial fibrillation, my experience is that a lot of the time it is sporadic and unpredictable. And this is what has the biggest impact on the individual's quality of life, because it is the unpredictability of the rhythm that can affect the patient's the individual's quality of life. So I would say in most situations, stress is a less common cause or trigger for atrial fibrillation.